scalpel, forceps.
Doctor, the BP is increasing.
Nurse, give 1 minute of Trimethaphan Camsylate right now.
الذين إذا أصابتهم مصيبة قالوا إنا لله وإنا إليه راجعون.
How many much do you give? I give 3 milligram per mil. I said 1 mil only.
Croatian-born Leo Henrik Sternbach, Ph.D., 1908 to 2005, escaped anti-Semitism and sailed from Portugal to America in 1940 by using his employer-facilitated Swiss passport to pass through Nazi-occupied France. At the Nutley, New Jersey, laboratories of Hoffmann La Roche, he perfected the world's first commercially successful synthesis of biotin, otherwise known as vitamin H, B7, or even coenzyme R. A related synthesis resulted in Dr. Sternbach's discovery of Trimethaphan Camsylate, which was trademarked as Arfanat in 1952. Roche advertised Arfanat as a ganglionic blocker for controlled hypotension and nearly bloodless surgery, especially for neurosurgery.
This is medicinal chemistry of Trimethaphan Camsylate. Next, this is the picture of chemical structure of Trimethaphan Camsylate, where the left one is structure of trimethaphan, and the right one is the structure of Camsylate. Based on the structure, we can appreciate that Trimethaphan Camsylate is a polar drug since it has several polar functional groups. We can appreciate the chemical properties of it. For example, its molecular formula. It has molecular weight of 596.801 grams per mole. It forms hydrogen bond in the body since it has 5 hydrogen bond acceptor and 0 hydrogen bond. The main clinical indications of Trimethaphan Camsylate. First, it is used as antihypertensive agent which help in acute or chronic vascular hypertension. Next, this drug also used as adjunct, which it is being administered in association with anesthetics to increase effectiveness, improve delivery, or decrease required dosage. Trimethaphan Camsylate also help to induce hypotension during surgery. Last but not least, it has also helped to control blood pressure of patient with acute dissecting aortic aneurysm. Next, I will explain about mechanism of action of Trimethaphan Camsylate. Trimethaphan Camsylate acts by prevent the stimulation of nicotinic receptor on postganglionic autonomic neurons. Specifically, it competes with acetylcholine to bind at nicotinic receptor. Hence, the stimulation of sympathetic and parasympathetic autonomic system by acetylcholine are inhibited. This makes Trimethaphan Camsylate has strong effect on cardiovascular system. Loss of sympathetic system input to blood vessel causes the blood vessel become larger. This will increase the peripheral blood flow and result in blood pressure become lowered. Trimethaphan Camsylate also causes release of histamine which causes vasodilation of blood vessel. This once again will increase the peripheral blood flow and therefore further lower the blood pressure. We will proceed to the adverse effect of Trimethaphan Camsylate. Trimethaphan Camsylate produces its numerous adverse effects, primarily due to its non-selective blockade of the autonomic nervous system. The adverse effect of Trimethaphan Camsylate is dose-dependent. So, when the dose decreases, the adverse effect also decreases. The adverse effect of trimethaphan Camsylate include orthostatic hypotension, urinary retention, tachycardia, dry mouth, restlessness, extreme weakness, precipitation of angina, urticaria, and cycloplegia. Trimethaphan Camsylate R contradicts to patient with anemia, patient with hypovolemia, asphyxia, and patient with glaucoma. Pregnant women sensitive to ganglionic blocking agent. These drugs also cross the placenta and decreasing the fetal GI motility and leads to meconium ileus. In addition, trimethaphan-induced hypotension may cause other serious adverse effect on the fetus.
Trimethaphan is a rapidly acting, titratable, ganglionic blocking agent used as an antihypertensive to produce controlled hypotension during surgery and for the emergency treatment of hypertensive crisis and pulmonary edema due to hypertension. However, it is rarely used because of adverse effects resulting from autonomic blockade and rare unpredictable reactions that include respiratory arrest.